you very much, Helen. We need to balance sentiment with reasoning and act with prudence on this issue. We salute the services of our nurses and then our midwives. But you can't also, Robert rule of meeting, you can't have a meeting when you don't form quorum. And the quorum here is that the Minister of Finance, a key stakeholder in paying them, and then the Minister of Health, who is their boss at that ministry, are not in town. So they don't form a quorum. And if you look at what is coming back again, because the first strike they did, 128,000 nurses and midwives jump into the street. Now the second one, they are threatening because of the suspended meeting. If we don't form a quorum, of course, we need to suspend our meeting. Even in Parliament, when they go, they don't form a quorum, they can't sit. So I'm pleading with them that because they don't form a quorum, and it is coming from the Minister of Health, and then the Finance Minister not in town, I think they are key stakeholders in making decisions. If they can wait, so I'm honing it to the deadline that they've given. So they are pushing back on the government, and I will cite a couple of things that they are looking for, which is interesting to me. But the kind of job that they find themselves, in most advanced countries, if you neglect your duty as a health worker, you'll be fired that day. You will be fired because you have signed to save lives. Nothing can replace life. My mother-in-law came to stay with us, and she had a knee problem. They were supposed to go and replace the knee cap. Do you know the price they quoted in US? $400,000 for knee cap. So imagine how much a head will cost, and your eyes. So we are priceless. Life is priceless, and we have only one life to live. And you swore to protect life.
Bear with me, Prof.
I have not landed yet.
Are you saying that we should compare them to nurses and midwives?
Our lives are in their hands.
Okay.
Midwives delivered us. And when we die, these nurses help. So you can go to any medical field. Even the doctors cannot work without the nurses. Everywhere they are, we need them. But look at the things that they are asking for. So my worry is that if they have total withdrawal from all OPD and public health services, what that means is that if you go anywhere, you can't have your services. And most people will die. When they did the first strike, I saw a lot of families crying that they will go to this hospital and they will tell them, we are on strike. Emergency, people are dying. And then they look at you the other way and say that we are on strike. That is worrying to me, that how much money can save life. So yes, they are negotiating. Whatever is due them, I have problems of some of the things that are due them. I also have problems with some of the process that we have here. So let's assume that I'm a board chair. And then before I came in, the previous board has agreed that every member of the staff is going to have double salary. Then I come in and realize that there are a lot of debts. So we can't honor that. Don't I have the right to renegotiate that with employees? I don't have the right to do that. So are we saying that union have always taken an entrenched position with government when the government has come and accepted that, yes, we agree with your demands? But the problem is that it's going to put a lot of stress on our budget. We need 2 billion Ghana cedis, about $195 million. We don't have that money now. So let's renegotiate. Maybe we can pay some of the things that you are looking for. Because doctors can come in, as Fred was saying, other people can come in, the police, anybody who is providing services, teachers, can also come in and say that you gave the nurses what they were looking for. We've also asked. So if this was negotiated in 2024, and now the new government sees the quantum of the debt, and then they are saying that let's come and renegotiate. And then you say that because the meeting was suspended, we are going to strike again. Well, it's a good threat because maybe that is the only way you can get what you're looking for. And I like the way they concluded that they are not going to rest on their hours until their demands are met. So let's look at some of the demands that they are looking for.
Certainly, and we can put some of that also up on the screen so you can all follow along on.
They are looking for book and research allowance. So I'm asking how many of our nurses do research. So we have to ask that question.
That's also on the screen, but this is not for all nurses. Prof.
Yes.
This is going to a specific category. I believe those who are pursuing PhD. And
exactly. So I will talk about that because I'm in academia.
All right.
So yes, teachers receive, professors, UTAC, they receive teaching and allowance, books and research allowance. So I want to see more research, and writing of books from these nurses because they are looking for allowances to that. Then uniform allowances, uniform. I traveled a lot. I don't see Mayo Clinic or Cincinnati Children that government provide your uniform for you. You buy your own uniform. I don't know how we built our system here. You buy your own uniform because you are paid salary. The same way that when you go for Congress, you want to be a congressman, and you go and contest and you win. Nobody goes to Washington and find you accommodation or car. So I have problems with members of parliament getting cars and then accommodation help because you are paid salary. Use part of your salary. Anybody who works for government, even in private, the same salary that we are receiving is what we are using to pay our rent and everything. Right. Why should we be giving extra? So we have a poor country that is giving perks. I don't know why. We are broke. And then let's go to other one, fuel allowances. I have done some research. Some directors, government institutions are getting 60 gallons of fuel a month. 60 gallons of fuel every month. Most institutions, go and check, government institutions, 60 gallons of fuel. So we should buy fuel for you too. We pay you salary. You need, allowances for uniform. You need book and research allowances. We should give you 60 gallons of fuel, fuel allowances. Then let's talk about non-basic allowance. I don't know what that means. But that is, I see here non-basic allowance. On-call facilitation allowance. Then we have 13th month salary allowance. That means we should pay them 13 months. That means every December, pay them double salary. Then continuous professional development allowances. So for a professional development, if I belong to any professional association, I pay my dues for that professional association. They want the government to pay for all these. Well, these are all lofty things that will help their work, facilitate their work. But do we have the money? And the government says we don't have the money, then we should take a pen and begin to use the red pen to strike. Which one can we do for you now and which one can hold? That is how we negotiate. So I think that you don't negotiate with, you can't shake somebody's hand when the person has a fist, and the person is not opening up their hand.
Who's got the fist?
The fist now is the nurses and the Midwives Association. They shouldn't clench their fist. They should open up their arms and talk to the government that, look, we need this. We negotiated for this. Your government has come and you are telling us there's no money. What can you do now for us? Then what can we hold on to so that when times are good, we can get on to that? I think that is how we negotiate. But the way things are going, I am scared because lives are at stake.
That's right.
And nothing can replace life.